morning, and thank you to the Pontifical Academy and to the University of Massachusetts Boston for hosting us. It is indeed an honor to be here. The great American politician Hubert Humphrey once said that a society is judged by how it treats those at the dawn of life, children, at the twilight of life, the elderly, and those in the shadow of life, the sick and the disabled. Using that lens, if we examine the global collective response to this pandemic, I think we can all agree we have some work to do better. The goal of the next 2 days is to talk about those at the dawn of life, children. The impact of the pandemic on children is broad and deep, and my goal is to really talk about the health effects. So, of course, over the next 2 days, we're going to cover a broad range of issues that have affected children over the last 2 years. We know that childhood is a critical time for development, for physical development, social development, mental and emotional development. And the 2 to 3 years of loss and poor development will actually have profound lifelong effects on health, on many other things, of course, but also on health in terms of higher risks of chronic disease and poor health outcomes. But today I want to focus on the more short to medium term. Now, when we think about the health harms of COVID on children, I think of it in 3 broad categories. The direct harm of the virus itself, the health harms of the pandemic and its broader response. Now, if we were talking about COVID in adults, it would be the same 2 categories. But there is a 3rd category that is particularly important for children, and that is the impact of the pandemic on the family. Because there is no way to talk about the impact of COVID on the health of kids without looking at that broader family structure. We'll come back to that. Let's begin with that first category of how the virus itself has affected children. Across the world, approximately 450 million people have been infected. That's the official statistic. We think that for children, the official statistics suggest between 30 and 50 million children have been infected with this virus. That is a gross undercount from a combination of a lack of surveillance, lack of testing, and lack of reporting. The best data and the best modeling suggests somewhere between 400 and 600 million children have likely been infected with this virus. When we look at the worst outcomes of this infection, which is death, again, official statistics suggest that between 13 and 15,000 children have died from COVID. Most of the data and most of the modeling would suggest that that is a substantial undercount by as much as 80 or 90%, and that the true impact in terms of number of children who have died of COVID is probably in the hundreds of thousands. That suffering is widespread, but it is not equally distributed. And as we heard earlier in the day, the worst outcomes are disproportionately found in poorer children who are at higher risk of poor outcomes because of malnutrition and other issues, in children of minority populations, and children who already have health burdens, children who already have health issues. Those are the children at highest risk of the worst outcomes. Beyond death, which of course is the worst of all outcomes, there are a series of other important direct effects of the virus that are worth talking through just for a couple of minutes. The truth is that we know that kids can have severe disease from this virus. In the US alone, there have been close to 10,000 hospitalizations of children. And in countries around the world, we know that the reason we don't see similarly high numbers in low and middle income countries is because access to healthcare is limited. And so kids have severe disease, children have severe disease, and often suffer from that at home. In terms of the outcomes of those severe diseases, obviously many kids recover, but are left with long COVID, which is a series of symptoms that can persist for extended periods of time, myocarditis, which is an inflammation of the heart muscle, which can resolve quickly, but in many children can have long-term cardiovascular effects. And then one of the more dreaded outcomes that has been largely underappreciated and underreported is something called MIS-C, which stands for multisystem inflammatory syndrome of children. This is a condition, we think it happens in maybe 1 in 2,000 or 1 in 3,000 kids who are infected, that days to weeks after they've recovered, they develop a very profound inflammatory response. It can cause a very significant autoimmune condition. Many of those kids do go on to recover, but many end up actually getting very, very sick and dying. And those are all unrecognized complications of COVID. So when I give you official statistics of how many children have died of COVID, it fails to account for all of the children who've gotten sick and died in the weeks that follow the initial infection because of MIS-C. If we look beyond the direct effect of the virus itself, there's a whole series of health impacts, some of which have been discussed today, and many of which will actually be covered in much greater detail during these 2 days. So I'm going to just touch on them briefly, but I think it's worth taking a minute. Certainly one is the mental health effects of this pandemic on children. They are large. We heard earlier today about data that suggests that there's been nearly a doubling of the reported symptoms of anxiety and depression globally, dramatic increases in emergency department visits for suicidality, hospitalizations, driven by isolation, family stress, anxiety about the pandemic, and so forth. And I firmly believe that the mental health crisis we are seeing in children is the crisis of the next decade that we in public health and medicine are going to have to work on. Another issue, again touched on lightly, is the large increase in physical and sexual abuse of children during the pandemic, driven really in my mind by 2 sets of factors. One certainly is all of the stresses and all of the challenges that families are facing, but the mechanisms by which we keep those in check, schools where children are seen by other adults, religious institutions, churches where those children are seen and taken care of, all of those have either been shut down or have had substantially decreased access. And that means that abuse has been able to flourish without any of the countervening forces that are so important. And then last but not least, we have seen a substantial backsliding in all of these health gains, measured simply even by things like looking at childhood vaccination. We think in the first year of the pandemic alone, 23 million children missed essential vaccinations. And vaccination rates at the end of 2020 were at the same level as 2005. So 15 years of progress reversed in the first 9 months of the pandemic. We don't have very good data yet for 2021, but I am not optimistic that we have made those back. We may have slid further back. So there are substantial challenges there. Let me just say a couple more quick things about that third category. So first category, direct impact of the virus. Second, the impact of the pandemic. Third, thinking about the issues around the impact on families. And here, there's a whole series of things. I'm only going to mention 2. One, of course, is the impact of the pandemic on poverty, and we're going to hear more about this from Professor Sachs. The pandemic has pushed tens of millions, as many as, by some estimates, 100 million children into poverty. That is going to have a long-term profound impact on the health of these children. We know that poverty increases malnutrition. Malnutrition in these development sort of critical years has long-term health effects. It reduces access to care in places where universal coverage is not widely available, and most of healthcare is accessed through cash and through out-of-pocket payments. As children are pushed into poverty, the access to care diminishes, and then obviously there are all the mental health effects of living in poverty. So these are going to be quite substantial. The second, which I was going to mention but has been brought up already, but I will take a minute and do it, is one of the most profound impacts of this pandemic on children is indeed the 5.2 million children, and that's a minimum estimate, who've lost a caregiver. Almost half of those children are now orphaned. We heard already some of the countries that have been largest, most substantially hit: South Africa, India, Peru, Brazil, and the United States. The cost of losing a parent, of course, the dramatic social and mental health costs but also the health effects. And these are things we're going to have to spend time thinking about and learning and figuring out how to counter. So let me take 2 minutes just to finish up to say, what do we do? How do we counter this? What are the important ways in which we prevent further harms and support those who already have been harmed? So in terms of countering the direct harms of the virus, I think one of the most important things we need to be doing and can and should be doing is vaccinating children against COVID. Too many countries have decided this is a low priority. Too many high-income countries have decided this is a low priority. Vaccines are widely available for children in the United States, and only about 25% of kids have been vaccinated. In many European countries, children are not yet eligible. I think this is a profound mistake, and I think it is absolutely essential. The data is very clear. When children are vaccinated, death rates go essentially to zero. You see little to no long COVID. You see little to no myocarditis as a complication of infection. So vaccines are not perfect at preventing infection, but they are profoundly terrific at eliminating complications of the virus. MIS-C, this dreaded complication of multisystem inflammatory syndrome in children, almost completely eliminated with vaccinations. So vaccines remain, in my mind, one of the most important issues that we can be focused on for preventing health harms to children. In 2021, you could make the case that when vaccine supplies were limited, targeting older people, more vulnerable people may have made sense. We are now entering a point in the global pandemic where we have more vaccine doses than demand. We're right at that tipping point on a global scale. In the months to come, we will see ample supply of vaccines. I think it is absolutely critical that we use those vaccines to vaccinate children. Finally, obviously, you've heard about this. We need to concentrate on the health impact of mental health challenges. I actually think there's a lot of promising opportunity here. There are new emerging technologies that can dramatically improve both access and quality of mental health services. There are new models of care delivery for mental health, training lay people to provide both basic diagnostics and therapeutics. We've had this mental model that mental health has got to be about training doctors, psychiatrists, psychologists, social workers. In fact, there's actually a lot of ways of improving both access and quality to mental health services that I think has not gotten enough attention. Obviously, focusing on families and social support, there's no substitute for lost parents, but there is a substantial role, I believe, for both civil society and religious organizations to identify the children who have been orphaned or who are so affected, and building a network of support around them. So let me just finish by saying, as you've heard before, this pandemic is not over. We may be, and it's just a maybe, we may be past the worst days. I hope we are. But we should assume there will be future surges, there will be future variants. And we need to focus on the health of children who have consistently gotten short shrift in this pandemic through vaccines, through therapeutics, through addressing issues of mental health. But then we also need to focus on the health of the family, because for children to thrive, for children to really reap the benefits of what is necessary at the dawn of their life, we need to support the families as well. Thank you very much.